Would there be any recommendations to do this based on regions? You keep mentioning Fraser Health, and that's where we see a bulk of the cases. Would you advise Dr. Henry or the province to think about this and open up care home visits in some areas of the province and not others?
I think we need to contemplate that. Certainly, we have taken a provincial approach to managing this pandemic, and I think we all have to agree that we have managed this pandemic relatively well. Even with these numbers we're seeing in the last few weeks, when we look across the rest of the country, we're still managing it relatively well. So you don't want to abandon the strategy that has made you achieve some desirable outcomes. But we did see, for example, with surgical cancellations and the creation of bed capacity in acute care, that there was an acknowledgement that we will do that on a more regional basis going forward. We already have arguably a site-specific response in that we do lock down completely a care home where there is an outbreak. So is it reasonable to say that there are some communities where there is a demonstrable difference in virus that is circulating in the community, and we may need to have a different approach there than in other areas? I do think we need to look at that, especially if we're looking at 3, 4, 5, or 6 months more. We don't know where our numbers are going to head.
Do you have a follow-up, Richard?
Isobel, I'm just wondering how you know that these visits won't lead to spread of the virus. Because obviously that is the biggest fear here, is that someone brings the virus into a long-term care facility and it leads to rapid spread that would likely lead to death. You speak to saying that people are screened and they're tested and they wear their masks, but how do we not know that they're asymptomatic and this could lead to more spread inside a home?
The fact is, if we look at the people who are currently visiting and expanding their visits, that risk is already there. We're not increasing that risk. They are already coming in. We are just having them come in more frequently, and there's an argument that we're actually reducing risk by having the visits in the private rooms. When we look at having additional people come in, which is a different issue that's been identified by family members, then you are mathematically increasing the risk. It is absolutely possible that they will bring the virus in. But I think, Richard, that the context here is to listen to the people that live there who are saying that's not the risk that they fear the most. We have risk everywhere out there. We have children going to school, teachers going to work. We have people getting on buses. We have drivers driving buses. We have people in grocery stores, people shopping in grocery stores. We set out saying we had to learn how to live with this virus and how to manage it. And we absolutely needed that time in the beginning to determine how we were going to do that, to get our PPE in place, to get our staffing in place, to get a number of pieces in place. So what does it look like when we live with it? Because when do we start to say to the person living in long-term care, at what point they're never going to see their daughter again? That daughter may have come to visit them every other day. Let's say, this is not uncommon. You've got the spouse is the one that's the designated visitor. They come every day. Their daughter used to pop in and see dad 3-4 times a week. She hasn't seen him now for almost 9 months. Is she never going to get to see him again? Because he's going to die. Not from COVID, but from, and that's the challenge here. It's part of this bigger conversation and recognizing that what are we keeping them safe for if it's not to spend the precious time they have left with the ones they've loved? These letters, thousands that came with this survey, time and time and time again. They would rather have COVID than never see their son, their daughter again.